First of all, I would like to thank you all for being here today and for your interest in this webinar. It's a great pleasure to welcome you all to our webinar organized by CiROCCO project on the health impacts of desert dust storms. My name is Petros Mouzouritis from the University of Cyprus, and I will be moderating today's session. Our aim is to make this webinar engaging and interactive. So during the session, we will invite you to use your mobile devices to answer a few short questions. Your input will offer valuable feedback to us, and of course, we will help our discussion later on. Before we begin, let me briefly present the agenda of today's webinar. Following this welcome, we will start with the first interactive session where you will be invited to answer two short questions using your mobile devices. Next, we will have an introduction to the CiROCCO project, followed by presentations on the health effects of desert dust storms, highlighting both academic research and community perspectives. And then a panel discussion with experts will focus on policy implications and stakeholders engagement. Then we will invite you once again to answer a few questions related to the capacity building goals of the CiROCCO project. And finally, we will conclude with remarks from Professor Panayiotis, who will share some key takeaways from our today's session. So I encourage you all to participate actively, and I hope to have a very meaningful and fruitful webinar. So let's kick off our session with an interactive opening. In a moment, you will see a QR code in your screen. So please use your mobile devices in order to scan this QR code. And please try to answer the first questions that will help us later on. Kate, could you please share the first questions and the QR code? Okay, so you can find the link in the chat room, but also if it's possible, we'll try to share. Yes, here it is. So you can please scan the QR code and try to answer the questions that will be shown in your mobile phone. So,
okay, I will move on to the first slide, Petros, I think.
Yes. So first of all, I would like to ask you which country are you from, to see the spectrum of different countries that participating in this webinar. So far, can see a lot of European countries, also Kenya and Korea, outside from Europe. That's good. So we have a wide spectrum of countries so far. Trinidad and Tobago, wow. United Arab Emirates. So maybe we can move to the next question. Here we would like to ask your expectations from this webinar. And finally, we hope to meet your expectations at the end of this webinar. So as I can see, different motivations. From different perspectives. Okay, so Kate, I think we can move to the next question, which is the final at this stage. Okay, so probably we can finish it here and we'll come back later to this survey. So now I would like to welcome Dr. Chrysoula Papathanasiou, the project manager of CiROCCO, to introduce the project. She will focus on its goals and how it relates to our webinar today. So, Chrysoula, the floor is yours.
Okay, good morning from my side. Let me share. I cannot share my screen.
Yes.
Okay.
I think now you can.
Yes, I can. And please let me know when you can see my screen.
Yes, we can, but not in presentation mode. Yes, now it's in
Now you can see it.
Yes.
Okay. Okay, so good morning from my side as well. First of all, I would like to thank all of you for joining our webinar today, our invited speakers, the attendees, and of course, Petros Moussouridis and Panayiotis Kouis from the University of Cyprus, who have a leading role in the organization of this webinar. I will present you in this introductory presentation the project CiROCCO in very brief, in a nutshell. My name is Chrysoula Papathanasiou, as Petros said. I'm a senior researcher in the Institute of Communication Computer Systems, and I'm the project manager of CiROCCO. So CiROCCO in a nutshell, the vision of our project is to establish an integrated sensing system. It will be composed of a distributed network of cost-effective oops, sorry. cost-effective devices and sensing nodes that will be coupled with state-of-the-art data fusion, remote sensing, and assimilation modeling techniques. Our network of sensors aims to enhance the existing undersampling, current lack of ground observation in desert areas. We foresee commercialization services to ensure the sustainability of the installation of our nodes and our sensors. And in parallel, we want to ensure the fair management of data, supporting cross-Copernicus ecosystem integration. In this project, we have 12 partners that join forces for the implementation of CiROCCO, coming from 7 countries. Institute of Communication and Computer Systems is the coordinator of the project. We have 5 academic and RTOs, 3 SMEs, 1 industrial partner, and 3 public organizations as project partners. And here you can see the geographical distribution of the partners. The objectives of our project, first of all, a business objective is the installation and operation of in-situ low-cost standalone electronic sensing nodes, and we want to ensure in this process, in the installation and operation, a real interest from local communities. One technical objective is the establishment of low-cost and sustainable network of nodes that will monitor the conditions, the environmental conditions in undersampled desert areas and ecosystems in Egypt, Serbia, and Spain. A second technical objective has to do with the development of data processing services based upon ICT infrastructure and improvement in air quality, in quality by data fusion services. A scientific innovation objective has to do with the enhancement of climate change models that will be used in the project and supporting the research for the European Green Deal challenges. Another scientific innovation objective has to do with the integration of cross-Copernicus ecosystem and assimilation processes. And an impact maximization objective of our project has to do with the adoption of our solution, of the CiROCCO solution, tools and services by the wider community. So in this graph, you can see an overview of what we intend to do and what we have already started doing in our project. So we will install a mix of low-cost and high-end sensing nodes on site, and we have data fusion services between high and low-cost sensors, high-end and low-cost sensors. Also, we have data fusion between Earth observation and in-situ measurements. In terms of communication will take place through wireless and also satellite for data collection. And all these data sets will be used to feed models and eventually serve the needs of 4 different services that we have foreseen in our project: air quality early warning system for human health, renewable energy system planning, land use and ecosystem management, and modeling of greenhouse gases and particles emission. And on top of all these, we want to ensure that we address at EU level sharing of data sets and services, and of course we develop business models of interest. So again, in brief, the expected outcomes of our project: the installation of sensors in 3 desert regions in Egypt, Spain, and Serbia, and 1 more region where we focus on today in Cyprus. Fully operational network for at least 10 months. The spatial coverage will extend over 2,000 square kilometers with 69 stations in total, monitoring at least 10 parameters. Currently, we monitor 13 parameters with the system as is now. The low-cost system will be made available with a 60% lower price than the current market. And as I said before, we will validate the data sets through the application in the 4 different services that we foresee in the project. We aim to offer increased accuracy and improved by 10% with in-situ data sets. And of course, we aim to collaborate, and we have started establishing such collaborations with working groups of GEO. The target is 5 working groups of GEO, Copernicus, and ESA. Here you can see an overview of the geographic distribution of our pilots. So renewable energy systems planning at the Benban Solar Park in Egypt. We have the desert dust storm events monitoring in Cyprus. The pilot 2, pilot 3 is sustainable environmental restoration support, and the pilot site is the Liblato Sands in Serbia. And fourth pilot is modeling of greenhouse gases and particles emission at the Tabernas Desert in Spain. Now I have one slide per pilot. I will focus only on the motivation for 3 of the pilots and a very brief introduction on our Cypriot pilot, where we will focus today. So for the first pilot, which is in Egypt, the motivation has to do with energy. So in this area, energy security is critical for local growth and prosperity. It's heavily dependent on solar power, and there is a need to predict production. Currently, there is a lack of forecasts, and when we have measurements, they're sometimes inaccurate. So CiROCCO comes there in order to support this the specific needs of this pilot. Pilot 3, I in purpose keep pilot 2, which is the Cypriot. I will leave it for the last one slide. So pilot 3 is our pilot in Serbia, sustainable environmental restoration support. The motivation for this pilot is the fact that this specific area, the Liblato Sands, are a habitat of rare or endangered endemic species of plants and animals. They're heavily exposed to strong winds that carry pollutants, such as toxic gas emissions. And on top of this, the area is particularly prone to fires, and it is also under unsustainable human activity pressure. So again, this is a sensitive area where air quality monitoring is a matter of priority. The fourth pilot is the Spanish pilot. It has to do with the modeling of greenhouse gases and particles emission. The motivation is, again, the fact that this specific area is vulnerable to greenhouse gases exchanges and particles emission. We have 2 experimental sites selected in this pilot, which are both part of a wider network of experimental observations that operates within the FluxNet network. And in this specific pilot, we aim to associate greenhouse gas exchanges and particles emissions with quality of groundwater. And for now, on our Cypriot pilot, desert dust storm events monitoring, the motivation is the lack of in-situ stations that record meteorological conditions and soil characteristics, and this undersampling hinders early forecasting. So the added value that is expected to be brought by our project in this pilot is that CiROCCO aims to increase, it will increase the number of existing data sources as we will install monitoring sensors. It will improve the understanding of early desert dust storm low altitude dynamics. It will enhance forecasting capabilities and provide real-time forecasts, and eventually an early warning system will be established. There is already something in place. We aim to further improve and refine the existing system. The scenario to be demonstrated, we will evaluate performance of existing models, and we will, as I said, further develop an early warning system that will be accessible through a website and as an application and available to the general public. And the partners involved, the leading pilot here is the University of Cyprus, that is also coordinating this webinar today, National Observatory of Athens, also supporting strongly this webinar, TEDARE, our Egyptian partners, IBOS, our partners from Cyprus, technical partners, Demos, which is a municipality of Idalion in Cyprus, Ministry of Labor again in Cyprus, ourselves, ICCS, and Intra, our industrial partner. So that was all in very brief what we intend to do in the project. I will want to stop sharing.
Okay, thank you, Chrysula.
Thank you.
First, I would like to say that at the end of all these sessions, we will have time for questions. So for now, I think we will move to our next presentation. Of course, I would like to thank Dr. Papathanassiou for this insightful introduction. Chrysoula, I think you have set the stage for our webinar and its goal for today. So now we can move to our next presentation. Dr. Panayiotis Kouis, a visiting lecturer at the Medical School of the University of Cyprus, will present his research on the health effects of desert dust storm events in the southeastern Mediterranean region, with a particular focus on the perceptions and practices of local stakeholders. So, dear Panayiotis, the floor is yours.
Good morning, Petros. Good morning, everybody. I would like to thank you for the invitation to present this work here and connect it with the work that CiROCCO is doing. As Petros said, I am an environmental health scientist from the Medical School of the University of Cyprus. The topic of this talk is to present some brief information about the recently concluded project Life Midea, which focus on the health effects of desert dust storms. And especially, we will focus how we engaged and the results we obtained from the local stakeholders, not only from Cyprus, but also from Greece and Israel, regarding their knowledge, their perceptions, and their current practices on how they can protect sensitive subpopulations from desert dust. Desert dust is a phenomenon that I assume is familiar with the audience of this webinar. These are some lovely pictures from Cyprus, Dubai, I think, Athens, you can see the Parthenon, but also in the bottom right is from the Swiss Alps, that we also had some desert dust reaching that north. As you probably know, it's a natural phenomenon. It's a phenomenon that we see it as increased PM10 and PM2.5 levels when these desert dust clouds reach Mediterranean or European areas. We know that because of the prevailing weather conditions and the proximity of the Eastern Mediterranean to both the Sahara and the Arabian deserts, this phenomenon is more frequent and more intense in the Eastern Mediterranean region. So Midea was a project that actually took place in exactly this region for this reason. It compiled partners from Israel, Greece, and Cyprus. And we know that this effect also affects health. We know that desert dust storms, the epidemiology of desert dust storm shows that there is a relationship with increased mortality and increased hospitalization and emergency department visits during these events and shortly after these events. We know that people with cardiovascular disease, people with respiratory disease, as well as children with asthma, that was one of our focuses in our study, are susceptible groups for desert dust exposure. And our project focus on mitigating these health effects. So although previous research efforts focus on describing this relationship, our project, the Life Midea project, moved a step forward. What we can do regarding the health, protecting people from desert dust storms. It was co-funded by the EU LIFE program for a total amount of 3.3 million. As I said, the consortium was from Cyprus, Greece, and Israel, and its primary aim was to provide the necessary evidence to develop a strategic plan for mitigating the health effects of desert dust storms through exposure reduction approaches and eventually inform EU decision centers. The effort to develop the necessary evidence, to gather the necessary evidence, was carried out with clinical trials involving children with asthma. We employed and atrial fibrillation patients, cardiac disease patients, basically. And we employed different solutions like warnings and guidelines and recommendations, and also indoor air cleaners. Overall, these were effective, and we got some good evidence to support the effectiveness of these solutions, especially the use of indoor air cleaners. The focus of this presentation is not to present this evidence that has been presented in previous CiROCCO events, but to show how we engage the stakeholders throughout this procedure in order for us to be able to develop this strategic plan utilizing this evidence. And needless to say, in order to influence policy, you need to engage stakeholders. And some key principles that we had in mind, and they are still relevant for any new project to engage stakeholders, is that you need to make sure that you have broad representation of diverse sectors, because there could be varied perspectives on the problem at hand. It's good to engage the stakeholders from the very beginning of the project and try to have a sustained interaction with them. This can be in the form of advisory boards, consulting services, and dissemination activities. It's suggested that co-creation methodologies and collaborative processes can be beneficial. You get mutual learning, both for the stakeholders and for the project, but also it allows the stakeholders to be part of the development procedure, and that creates additional momentum when these solutions are put into policy. There are also the need to maintain relevance of the solutions that the project provides, as was in our case. It had to adhere to user needs, so we have to engage stakeholders to understand their needs. And of course, any engagement with stakeholders needs to follow a strategy. The strategy needs to be adaptive and responsive. It needs to take account the stakeholder feedback, and depending on the area or the cultural norms or the literacy level, in our case, the health literacy level, this engagement strategy needs to be adapted. Eventually, through this procedure, you can enable the whole system and the stakeholders to increase their capacity, and this can be done during the whole duration of the project through knowledge sharing and empowerment. Implementing these principles at the start of the media project, we carried out the stakeholder mapping exercise, and through that, we created the media advisory committees at each country. These were stakeholders, both social stakeholders, that's a general term to describe any stakeholder that was interested or affected from this desert dust phenomenon and its health impacts, and the regulatory authorities, the organizations, the government organizations that had any form of responsibility in protecting the public from this phenomenon. So social stakeholders were patient support groups, medical associations, parent associations, because a lot of our work took place in schools with children, trade unions, municipalities, and academic and research organizations. From the side of regulatory authorities, we have educational ministries, health ministries, and environmental authorities or environmental ministries. All these were mapped across the three countries, in Greece, Cyprus, and Israel. On these stakeholders, we carried out a survey study to assess their perceptions and practices on how they deal with DDS. It followed a cross-sectional survey design, used semi-structured questionnaires, and it took place at the start of the project, so before the project had any interaction with the stakeholders, and at the end of the project when these stakeholders have already been participating and working with us for 3, 4, 5 years, respectively. These questionnaires specifically address their knowledge on DDS events, their perception of the relationship between DDS events and the health effects, and what they do, what were the relevant actions taken by their organization towards protecting public health from DDS events. The participants in the survey, they were representative of our mapping exercise. So we got a variety of participants with a wide distribution that was roughly relevant to what we have mapped at the 3 countries. In terms of their knowledge and perceptions, all responders were in general familiar with the DDS phenomenon. However, several underestimated the frequency of the events. For example, we know that in our region, we have about 15 to 30 events per year. That corresponds to approximately 13 to 36 annual dust days, depending on the site that we are talking about. But overall, 90% of responders reported lower frequency, which that demonstrated a very wide underestimation of the phenomenon. We underestimate seasonality of the phenomenon. We know that in spring, desert dust events are more common in our region, followed by fall. There was some misunderstanding across the stakeholders about this, because they thought that desert dust was more common in spring, more common in summer compared to fall. And in general, stakeholders were aware of the health effects, but they identified correctly several susceptible subpopulations. However, although they mentioned a lot of respiratory conditions and allergies as main health effects, there was also an underestimation of the health effects for the cardiovascular system. So although we know from the epidemiology and the evidence we have available that desert dust is very harmful for the cardiovascular system, and particularly the evidence from epidemiology may be even stronger for the cardiovascular system, the stakeholders involved, they were mostly responding about respiratory problems. And this is their distribution of responses. It was impromptu responses, whatever they thought that were coming first on their mind, and most of them, they were talking about the respiratory system. Very few correctly identified cardiovascular system as a system that is affected by desert dust storms. Also, a large percentage of our responders, they were unaware of a national policy on desert dust storms, or consider that this was lacking in their country. This was as high as 71%. And although some of the stakeholders, approximately half of the regulatory authorities and some social stakeholders, they do get questions from the public regarding desert dust storm effects. Only few reply in a predetermined way and using some standardized responses through an action plan. But this was at least half of the regulatory authorities, they do respond in a predetermined action plan. The majority of stakeholders social stakeholders believe that neither the decision makers nor the public are fully informed on the potential health impacts of DDS. So there wasn't demand for additional education and additional information. And a minority of them report that they do receive some form of early warning about these events, although they don't do anything about it. Even if you are a trade union, for example, or if you are a medical association, you receive these warnings in some areas, but you are not obligated and you don't do any actions to disseminate this information. After the end of the project, after we have carried several dissemination activities, after we have carried our dissemination surveys, we repeated this survey with the same stakeholders, and we have seen some improvements. More particularly, as I said, there was an underestimation of the frequency of the events at the start of the project. So compared to 2018 survey, the survey at 2023 showed that the people responding accurately to how many episodes we have per year increased considerably. Also, our understanding, the stakeholders' understanding of the seasonality of the desert dust episodes improved, with more people reporting that fall was also an important season for DDS events preparedness. And also, we have seen a great increase in the number of stakeholders receiving questions from the general public on or vulnerable populations. So during the duration of the project, probably partly due to the actions of the project, the awareness in the public was greatly increased, and the different organizations who were receiving more complaints or questions from the public regarding questions about desert dust events. And among social stakeholders, there was a significant improvement in the knowledge of the existence of a national policy to promote protection from desert dust events. So in 2018, almost half of the 43% of the stakeholders considered that there was something relevant in their country, and this increased to 63% by the end of the project. Overall, beyond this survey that we were able to monitor and interact with the stakeholders, as a project, we increased awareness through different activities, and this includes also a 50-minute documentary on desert dust health effects and the solutions that the project provided. We developed evidence-based guidelines for mitigating the health effect of DDS. These guidelines are available in animated and text format. And of course, they are available both in the project languages, Greek and Hebrew, but also these are translated, both the videos and the text to English, so they're available for other sites for translation and dissemination. And of course, these guidelines will be utilized by CiROCCO in their preparation of the early warning system for DDS. Also, for each country, we prioritize the meteorological models for desert dust storm forecasting, and we have contributed towards the introduction of a series of regulations in Cyprus, both in the educational and occupational health sector, for the protection of children and outdoor workers, respectively, from desert dust events. And all of these are summarized in a newly developed national action plan on desert dust adopted in Cyprus by the relevant authority. In conclusion, I would like to say that effective engagement of stakeholders is a necessary component for any successful public policy transformation, including public health policy transformation. In media, we were able to do that by engaging the critical stakeholders through national advisory committees, and we were able to get their inputs, their user needs, and understand the gaps in current policy. And of course, these stakeholders contributed towards the development of our project solutions. The engagement methods may vary. This could be surveys, interviews, workshops, focus groups, and others. My presentation focused on a survey. Subsequent presentation by our colleague Kinni will focus on more personal interviews and focus groups. And of course, a main element is that we need continuous engagement also after project completion. And this is what we are doing today. This is a task that is also falls under the media afterlife plan. We need to engage the public. We need to engage the stakeholders also after the project end. And of course, our participation in the CiROCCO project also falls under this requirement. Finally, thank you for your interest. And I would like to thank the people involved in the media project, especially Professor Yalros, who was the media PI, and Petros and Evi for their contribution for today's presentation. Thank you.
Okay, thank you, Panayiotis, for this very interesting presentation. I will take your last message as a keynote for our webinar. I mean, how important is to engage from the early beginning the stakeholders in such projects and studies. So thank you. So moving forward, I'm pleased to introduce Ms. Evi Kinni, a PhD candidate at the School of Health Sciences at the Cyprus University of Technology. Ms. Kinni will share her research on community-level perspectives regarding desert dust storms, with a particular focus on their health impacts. Her insights are essential for understanding how these environmental events affect local communities directly. So, Ms. Kinni, the floor is yours.
Hello, everyone. Are you seeing my screen?
Yes, we can.
Okay.
Yes, perfect.
Good morning, everyone, and thank you for joining the webinar today. I want to thank the organizer of this webinar, especially CiROCCO project team, for the invitation. Picking from the previous presentation where we explored stakeholder perception and practices around desert dust storm events, in the next 15 minutes, I will share insights from the field and the community on health effects of desert dust storms, with a particular focus on vulnerable population like children, and the critical role of families, schools, and health professionals. Desert dusts are a common phenomenon in the Mediterranean area and in Cyprus, and their frequency and intensity are increasing, and due to climate change, posing a significant health risk, especially for children. Our research aimed to understand how families, schools, and health professionals perceive and respond to these events. Through this exploration, we tried to identify key patterns in belief and practices, highlight challenges and gaps, and explore insights for resilience and health protection. Why we focus on school and children? Children represent a particularly vulnerable population when it comes to health impacts of desert dust storms, especially those children with pre-existing respiratory conditions. Why we choose schools? Schools where children spend a significant portion of their time and day and play a crucial role as a community setting for implementing exposure reduction measures effectively. By targeting schools and families, we can not only address immediate health risks, but also foster a proactive approach to resilience. Furthermore, policies that consider public perception and behaviors are essential for effectively adapting to these challenges, with schools serving as a key hubs for community-level action. Let me introduce the three participant groups that we engage with. First, parents, who are the primary caregivers and decision makers for children. Second, teachers, who are frontline professionals for ensuring a safe environment during school hours, particularly for children vulnerable to desert dust storms. And third, health school visitors, that they are the key health professional responsible for monitoring student health during in school settings. Together, their perspectives give us a comprehensive view of desert dust storm impacts and gaps in preparedness. Moving now to the findings from the three groups. First, parents, particularly those of asthmatic children, view desert dust storm as a severe health risk. Anxiety is a common not just among parents of vulnerable children, but also among those of healthy children. One parent shared a powerful sentiment. Suddenly, this influx of dust initially caused me anxiety. I tried to manage, but I still creates tension and affects my health. If things continue to worsen based on the current situation, at some point, something must be done. It means we won't be able to go outside anymore. Many times I have thought about relocating. Where can we go, to which country? But not everyone can simply pack up and leave because of this. So something must be done. Some measure needs to be taken. These concerns underline the psychological toll desert dust storm events have on families. Parents take measures such as staying indoors and cleaning, but barriers like unclear warning and practical constraints limit their effectiveness. While some confidence exists in handling minor situations, parents feel unprepared for severe cases. This reflects a need for improved communication and practical tools to support families during desert dust storm events. Cues such as visible dust and public warnings, children's symptoms, past experience, prompt action. Here are some direct voices from parents that illustrate the diverse challenges and proactive measures they undertake to cope with desert dust storms. One parent stated, "We try to follow the guidelines. There are not much more that you can do. If you're at work, you will have to go. And if you're at school, you will go. You try to live normally. At least let's follow it for this one day, if not for 4 out of the 7 days, on the one day when there's a red warning." Another parent stated, "If there's a dust outside, I won't take the children to the park. There are people who are not informed. If the problem doesn't affect their household directly, they cannot grasp its significance." And another parent said, "On my own, I was reading on Google. I even download the air quality application on my phone. Ever since the day we discovered that this problem exists in our area, I started researching and reading about what we can do to protect ourselves." But also parents feel that there's a lack of government involvement and effective policies. As one parent stated, the government needs to take action and create a plan. There should be devices in indoor spaces to clean the air, because you cannot do much about the air outside. Many activities will now need to be moved indoors, parks, play areas, even in schools. For example, covered indoor spaces are necessary. Right now, even the school playgrounds are partially covered in the center, but mostly open. Proper ventilation is essential, but is currently lacking, not only in schools, but everywhere. While parents provide valuable insights into the challenges they face at home and their efforts to protect their children, the role of teachers is equally crucial within the school environment. Teachers who are on the front line of safeguarding children during school hours provide unique insights. Teachers recognize children's vulnerability to desert dust storms, but believe its severity is often underestimated. One teacher share is not just dust. It carries particles, chemicals, and microorganisms. We don't treat it seriously enough because we only see it as a dust. Despite the awareness, systematic gaps and resource limitations hinder the ability to act effectively. Challenges in schools include unclear protocols, poor infrastructure, and difficulty enforcing protective measures. One teacher noted, "These decisions are left to individual schools. The circular provides general guidelines, but it's up to the principal to decide what to do. There's not a clear protocol. What if children don't bring masks? Should I supply hundreds of masks myself? And even if I have masks, how can children endure them in this heat? The school lack proper infrastructure like air purifiers or well-ventilated spaces. Even if we keep children inside, the dust still gets in. This phenomenon disrupts school activities daily. No breaks, no gym, no field trips. Even staying inside isn't enough because the dust still penetrates classrooms." Teachers rely heavily on visible environmental cues and public alerts, such as haze and so on, but they need more precise school-specific guidance. Another teacher described the frustration of vague guidelines. The color code system says to monitor children, but how do we decide what is safe? Clearer and more actionable information is essential. Teachers see the benefits of measures like indoor activities, improved ventilation, and clear guidelines as critical steps to protect children during desert dust storms. However, their ability to implement this action is often hindered by a lack of training and adequate resources. One teacher shared their challenges they face, stating, "When the dust comes, I have to make decisions on what to do. The problem is the lack of clear guidance from authorities, and each school makes its own interpretation. There should be proper infrastructure, air purification systems, ventilation, and closed space for schools. Right now, we are just hiding from the problem, not solving it." This sentiment reflects a broader issue of insufficient support and the absence of a cohesive legislative framework. The teachers also further noted that the guidelines are minimal, just a color-coded system. This issue affects everyone, yet there is no legislation or framework to enforce action. Even in schools, we are left guessing what to do. Teachers emphasize the need for government action, including clear policies, infrastructure improvements, and targeted public awareness campaigns. They also advocate for educational programs, training, and an improved ventilation system in schools. One teacher stated, "We're just hiding from the problem, not solving it." Stronger government initiatives is critical to addressing these gaps. While teachers focus on daily protection, understanding how school health visitors perceive and address the health impacts of desert dust storms on children, particularly those with asthma, is crucial for developing effective school-based intervention. A descriptive cross-sectional survey sheds light on their knowledge, practices, and perception. The study surveyed 78 out of 93 school health visitors in Cyprus, achieving a response rate of 84%. Participants had an average of 30.5 years of professional experience, and using an anonymous questionnaire, the research assessed the perceived importance of childhood asthma management practices, current implementation of these practices, and preparedness of regulatory authorities to respond to desert dust storm events, evaluating using 1 to 5 Likert scale. Findings from this study reveal a significant gap between the perceived importance of asthma management measures and their actual implementation. Key practices like asthma control assessment, tracking absenteeism, and monitoring triggers score notably low. And desert dust storm-related measures such as real-time monitoring and public awareness were also infrequent. Authorities' preparedness was rated as moderate, with slightly better ratings for public health services compared to others. However, recognized that the severity of desert dust storms was strongly linked to greater support for school-based intervention, underscoring the need for targeted action. Key findings highlight suboptimal asthma management practices in Cyprus in school settings and fragmented response to desert dust storm events. Despite high awareness and support for intervention among school health visitors, they are not consistently translated into practice. A coordinated effort is essential to develop and implement comprehensive policies and action plans to address desert dust storm events effectively in school settings. So, across groups share challenges include inconsistent messaging and a lack of reliable information. However, while school health visitors adopt a systematic approach, parents and teachers focus on immediate practical concerns. The gaps we have identified underscore the need for community-level resources and structured policies. Collaboration between school, families, and health professionals is essential. Short-term actions like installing air purifiers can mitigate immediate risk, while long-term solutions require infrastructural investments and enhanced communication. In summary, desert dust storm poses significant challenges for schools and families, exacerbated by gaps in education, resources, and policies. Addressing the health impacts of desert dust storm requires an effort from all sectors. School, families, health professionals, and policymakers must work together to create a safer, healthier environment for our communities. The next step in my PhD will focus on further analyzing these findings to develop actionable recommendations that address the health impacts of desert dust storms on vulnerable children. Taking this opportunity, I want to express my sincere thanks to everyone who made this research possible, to Dr. Panayiotis Galleros, the coordinator of the Life Medea project, and Dr. Panayiotis Kouis, the manager of Life Medea. Having had this privilege to work on this multidisciplinary project myself, I deeply value the expertise which have been pivotal to advancing our understanding of the health impacts of desert dust storm events and effective adaptation strategies. I would like to thank my supervisor, Dr. Andri Panayiotou, as well my advisory committee, Dr. Nikos Mitleton and Dr. Georgios Nikolopoulos, for their mentorship and valuable insights. And big thank you to Dr. Melanie Haralambos from the Educational Sector Nursing Services from the Cyprus Cyprus Ministry of Health for her continuous collaboration and support. To all the participating parents, school directories, teachers, and health visitors who generously share their perspective and experiences. And finally, I would like to thank the organizer and Dr. Panayiotis Kouis, Dr. Petros Mouzouridis, and Dr. Chrysoula Papathanasiou that provide this platform to discuss such a vital issue. Thank you for your attention and being part of this important dialogue. I look forward to the discussion panel and the valuable insights.
Dear Abby, thank you for your presentation. I think it is very important to see the practical challenges and the perception, how the general public perceive all these challenges and the effects of such events. So now, after the two very insightful presentations, I would like to invite Professor Panayiotis Giallouros, Professor of Pediatric and Pediatric Pulmonology at the Medical School of University of Cyprus, to share his thoughts about this topic. A few words about Professor Giallouros. Professor Giallouros has extensive experience in addressing the health impacts of desert dust storms, having coordinated and participated in international research projects in such topics, at least for the last 12 years. So, Professor Giallouros, we are looking forward to hear your initial reflections on the presentations and make more comments about this issue.
Thank you, Petro. Thank you all for having the time to listen to some views about this issue. Of course, Life Medea and CiROCCO are focusing on desert dust and its effects in the region. But in general, the Mediterranean region has a major air pollution problem. And this is a problem to do with the airborne particulate matter, as it is measured with PM10 and PM2.5 parameters. And of course, the particulate matter in the region is not only coming from desert dust, it's coming from local anthropogenic sources, and it's also coming from resuspension of the particulate matter from the ground. And this has to do with the climate that we are dealing with in the region. We are at the edge of the arid desertous climate of the northern Africa. And as the climate change is moving forward, this arid climate is moving to the northern areas and is affecting us, affecting the whole Mediterranean and Europe. And this change in the precipitation is enhancing, of course, the production, the appearance of the desert dust events, but it's also enhancing the resuspension of the particles. So the whole region is, severely affected by high PM10 and high PM2.5. In Cyprus, for instance, 80 to 100 days per year have exceedances of PM10 levels. This is very serious. 1 in 3 days in to 1 in 4 days of the year, we have exceedances of the threshold set by European Union for PM10. So it's a very serious and very frequent problem. As I said, we are focusing on desert dust today, but it's not only desert dust. And if you see the appearance of the events, of the desert dust events in the region, there are clearly days where the great majority of this particle is coming from desert dust, but there are days we have a mixture of desert dust and local sources PM10, and days with predominantly local sources PM10 and PM2.5 that also are exceeding the thresholds. So in reality, we are facing with a very complex problem that is very frequent. It has, this influence from the desert, but it's not only that. And the particles, regardless of their origin, are having these harmful health effects that Panayiotis has talked about a little bit earlier. And the issue here is, and the topic, of course, of the seminar is the practical policies and the action plans to deal with these exposures. And to make it a little bit more complex, we are looking for guidelines and interventions that address the whole population, but we are also very much interested into recommendations for the vulnerable population groups, those who are more likely to develop adverse health effects because of these exposures. So there is another level of complexity into these possible recommendations and policies. The preconditions to start sort of working on policies and implement them is awareness. And Panayiotis and Evi gave a good sort of insight into how people, stakeholders in the region are sort of looking into this phenomenon. But I think we've done quite a lot of good work in the last few years in increasing awareness, in increasing early warning systems for the appearance of desert dust, but also of exceedances of PM10 and PM2.5 of various sources. And these are important prerequisites, preconditions that would create motivation and mobilization of individuals, but also of stakeholders, policy, regulatory authorities, and so forth, in order to take action. Up to this point, I think we are doing quite well. Of course, when we come to what to do, then I think we have significant gaps and we don't really have specific instructions and interventions to people, both at the general population level, as I said, but also at the susceptible population groups. The presentation of Evi really reflected the agony and the uncertainty of parents, of school teachers, of community nurses, of what to do and how to intervene and how to help. I think in this sort of level, we are still quite at the beginning. We lack a lot of knowledge of how to intervene, at what level, and whether this is going to be a universal sort of intervention, whether it's going to be addressing only the susceptible ones, and so forth. And of course, at the house level, at the family level, the interventions can be more straightforward because more or less you have control of what you do at your house, and with your family members to some extent. And from our study, the Medea study, when we sort of intervene at the houses levels of the asthmatic children, the results we got were very good, really impressive, with good responses. Of course, there were people that were motivated, people that have children with asthma, people that had heart problems, and they have the motivation to respond and take measures. At the school level, at the workplace level, things are more complex because many stakeholders and many other priorities come into play. You have at the school level, the teachers, the school nurses, the parents, other children that do not have, susceptibilities like asthma and so forth. And the same happens in the workplace. So things are more complicated there and more difficult to be sort of adopting specific recommendations and measures that come up with action plans. And of course, there is a big unknown in this equation, which has to do with the indoor air quality in our countries. Indoor air quality in our countries, at the house, at the school, classroom, at the workplace, is not well assessed. Of course, there is penetration of suspended particles from outside. This is something we understand. We don't understand well what is resuspended in these indoor places, at the house, the school, classroom, the workplace. And at the house, more or less, the people are few and the resuspension is not so much, although there are activities, as you know, that enhance resuspension. But at the school, classroom, the workplace, this is very much affected to many factors. How crowded is the place? What is the outdoor sources that come in with shoes, with activity? What is penetrating through the doors and the windows and so forth? What is resuspended with the ventilation systems and so forth? So a lot of things we don't know about this indoor air quality in the Mediterranean region, where we have this big problem with the arid climate. And I think we need to delve more into this, research more into this. And then it comes the the final stage of the intervention and the action plans of what to do. Shall we do air purification? Shall we do specific ventilation systems? Shall we sort of introduce measures to reduce resuspension in the indoor spaces? These are the big questions. And I think there is a lot of work to be done in this field in order to answer all these worries and questions from parents, from school workers, from health workers, how to intervene, what to do, and when. I think I will pause here. I don't know if there's any others ideas.
Okay, yes, I think we can stop here. Anyway, at the end, I would like to ask you to give us an overview and some key messages for this webinar. But for now, I would like to ask Dr. Chrysanthos Savidis, the head of Air Quality and Strategy Planning Section at the Department of Labor Inspection in Cyprus, to share his thoughts about the role of air quality monitoring in shaping policies aimed to mitigate the impacts of desert dust storms. So please, Dr. Savidis, share with us some thoughts about this.
Hello, everyone, from my side. My name is Chrysanthos Saris, and I'm the head of the air quality section here in Cyprus, who is in the competent authority for the air quality directive here in the island. I would like, first of all, to thank all of you for the coordination, for the very important information provided to all of the participants about the desert darts and the organization of this webinar. Our goal as a committee authority is to, based on the provisions of the air quality directive, is to protect the job population and especially the vulnerable group of population and the employees concerning these episodes taking place in the Cyprus atmosphere. As Mr. Yallouros, Professor Yallouros commented, we have, let's say, a big problem here in Cyprus because these episodes are coming now and then, let's say 1/3 or 1/4 days all over the year. So you can realize that the problem Cyprus are facing is quite big. And this is something that is not we are facing the last decade, let's say, or the last years, but this phenomenon is quite long. Although the competent authority, with the help of the participation in several projects like CiROCCO, like live media, we take several actions in order to inform the general population and the employees about this phenomenon in order to take some actions to protect themselves. It's well known that there is not many actions taken by the competent authority in order to minimize this phenomenon. And I talk about desert dust storms. So our actions taken concerning the anthropogenic sources of the particulate matter. So based on that, and especially for the desert dust storms, we issuing announcement in order to inform the population or the competent authorities here in Cyprus in order to protect their employees. The Ministry of Education in order to protect the pupils and the teachers. The Ministry of Defense in order to protect the soldiers. And all generally all the ministries in order to protect and take actions in order to, the Ministry of Health, of course. We issuing an announcement, we giving interviews in the TV stations and the radio stations in order to inform the population, and this is action are taken the, let's say, the late 5 years. We also provide to the general population a mobile application in order to have immediate information about the event. So I would like to conclude to say that your help and the results of all the projects are an extra tools for our in order to establish and enforce our goal concerning the protect of the general population and all the people here in Cyprus concerning this issue and the dust storms, especially the dust storms. Thank you very much, and I'm here with you in order to discuss it, any issue arising from this webinar. Thank you very much.
Okay, thank you, dear Chrysanthos. I think the example of your department, your sector, is a good example how the competent authorities try to address these issues, and first of all, how to inform the general public about the upcoming desert dust events in order to protect themselves. So thank you for that. With this, I would like to invite also Dr. Andrei Panayiotou, Associate Professor in Public Health at the Cyprus University of Technology, for her comments. We would like to hear about her opinion about the importance of community engagement in such public health interventions. So, dear Professor Panayiotou, give us some comments on that.
Thank you, Pedro, and thank you for both the invitation and for the presentation of all the data so far from the Life Media project. First, I'd like to start by saying that it's very important that CiROCCO is taking a holistic approach in looking at the issue, looking at land use and deforestation. So going back to the root causes of dust storms and not just the immediate effects, and also the early warning systems that Chrysanthos Savvidis has also mentioned. I think it was very clear based on what we've heard from both Panayiotis, Kouis, Professor Gallouros, and Evi Kinni, that stakeholder engagement is crucial in understanding population behavior and how and barriers and perceptions of risk with regards to dust storms, but also with competing health risks. It was very clear, I think, that there is a need for tailored and clear messaging, because we all understand that there's dust outside, we can see it. There's a lot of work being done on awareness, and it shows on the data. But the gap and the big challenge here, what Professor Gallouros also alluded to, is what to do. What to do if you're a part of a vulnerable subpopulation, what to do if you're a member of the general population, if you worry about other things. So the big challenge is to answer the questions, like Professor Gallouros said, and provide the evidence that can then be used to provide the clear messaging and the tailored intervention. Because desert dust storm is a very serious problem in Cyprus and Eastern Mediterranean, but on our daily decisions, we have to consider several competing risks. So staying indoors, going outside, there's risks associated with all the decisions that we make and the actions that we take or we don't take. So it's important to have the evidence to back tailored and clear messaging for schools. And there's a clear need for schools to have protocols and know what their actions need to be based on the different levels of particle concentrations, but also at the population level. And I think I'll stop here and allow for more questions from the audience.
Okay, thank you, Dr. Panayiotou. I think we will have some time later for any questions on that. Thank you again for your intervention and for your comments. And now we are moving to our last panelist. Last but not least, I would like to give the floor to Ms. Melanie Haralambous, Senior Nursing Officer at the Nursing Services of the Ministry of Health in Cyprus, to also hear some comments about the readiness of the healthcare system here in Cyprus, about the desert dust events and how we address the impacts of such events.
Dear organizers, dear attendees, good evening. First of all, I would like to congratulate the team of CiROCCO and I wish luck in their project activities, and also to congratulate the speakers of today's webinar. I'm very glad to see my media family. Through working closely with them as an advisory committee member over the past few years, I have gained valuable knowledge from both academics and from the representative of the involved services and ministries. And it's my honor to be a discussant in this webinar. Let me refer to the events before the start of the project of media project. It is accepted that during the previous years in our country, the actions of health care professionals on the management of DDS were limited and varied, and the level of knowledge differed. This assessment was appeared empirically from the frequent discussion between the members of the MIDEA's advisory committee and from the research that carried out and were already mentioned from Panayiotis and Evi. Throughout the MIDEA's actions, the awareness of the general population, vulnerable groups and families and health professionals has been achieved. The informative lectures and videos they have developed, the equipment they have used, and the given material have made these significant changes regarding their awareness. Furthermore, significant benefits was the interaction between the advisory committee. I believe that these key people contribute a lot in their areas of practice and have a positive influence to help shaping policy at the national level. Before I continue, I would like to report some revised practices that arisen after the completion of the media project between Ministry of Health and in collaboration with Ministry of Education. We tried to update the health report of children with asthma at the beginning of the school year. Staff communicate more often with parents and children and give continuous support regarding dust episodes. They encourage parents to follow the current guidelines during the dust in storms. Furthermore, teachers adapt their activities by having a special action plans if NDDS arise. And we encourage staff and general population for continuous monitoring of the air quality mobile application throughout the year. Now, regarding our steps, and as mentioned before from Professor Yallouros, we have to continue and develop and revise policies based on evidence-based practices that are tailored to specific populations and specific high-risk areas. Undoubtedly, media has provided the basis for the continuation of this process, and we have to build on this excellent work. On this excellent work. We have to continue to develop regulations from the involved bodies. In some cases, recommendations should become regulations because recommendations lead to different approaches by organizations and perhaps leads to non-compliance. And I believe that the most important component in this effort is, yes, we have keep the continuing education starting from all healthcare professionals and then the general population, so that can be achieved to the maximum extent, the prevention from the effects of dust storms events and the effective management of them. Thank you.
Okay, thank you, dear Melia, for your comments. I think your role is very important and crucial for the effective implementation of all these policies. I think it's very important. This. So now I think we have a short time for open the floor for brief questions from our audience. So please feel free to ask any questions, or we would like to have your comments about this webinar. And after this Q&A session, we will proceed to the next interactive session with some questions that we would like to ask our audience for our capacity building within CiROCCO project. So for now, we can take some questions from our audience. We have any questions or comments? Feel free to participate in this session. Okay, if not, and since we don't have enough time for the end of this webinar, I would like to ask Eleni, Dr. Athanasopoulou, to take the lead about the next session, the questions that we would like to ask our audience, and we'll finish with some key conclusions from Professor Yallouros.
Thank you, Petro. Hello to everyone, and thanks to all the presenters, participants of this webinar. I work at the National Observatory of Athens. My field is on aerosol and air pollution and using numerical atmospheric modeling. But here in the frame of CiROCCO, I lead a task that is relevant to the capacity development procedures that are necessary for CiROCCO, because we are developing a sensor system, as Chrysula said in the beginning, and we need this system to be sustainable. So we need to build capacities of stakeholders. So one of the capacity means we have decided to be a series of webinars, and this was the kickoff of this series. But since we want to continue and evolve the procedure and keep the good practices and improve whatever possible, we ask for all participants and all the stakeholders, all the people that are present here, to import some information in the Mentimeter as you used before. So you can either connect to the link that is provided in the chat, or use the same connection you did before with your mobile phone, and continue with some 5 or 7 questions, simple questions that we have built for you. So, Kate, if you could move to the next slide. So before starting the presentations, we asked what was your expectation and the motivation of connecting here. So we would like to evaluate if the webinar has met your expectations, and it is valuable that you all rate this from 1 to 5. 1 not met your expectations, 5 fully met your expectations. So that we know how it went overall. And yes, since we are 47 people connected, it would be nice to have everyone everyone's feedback on the webinar. We wait for a couple of seconds so that you all participate, and then we can move to the next one. So Kate, maybe you can move. So here it is a free text for you to select a keyword, a take-home message, or what you have gained through participating in this webinar. So yes, important to know that stakeholders are important, and please share any other take-home message or what was important for you to learn after. Very nice messages we see. So as you think about this, I want to mention that we have recorded this webinar so that we can have it virtually uploaded, just the presentations, not the whole duration, at the website of CiROCCO, and also that we plan to issue a certificate of attendance that we can sent to you offline by email to all of those who have attended to the webinar. So Kate, maybe we can move. As I said, we plan 10 or 9 or more webinars during CiROCCO. So if you have in mind any other informative webinar that could that you need to raise your awareness or you need to develop your capacity, it would be great to have your feedback. We have already a list planned, but we want to have a feedback from the actual stakeholders to make this list to the best possible useful for the most people. Kate, maybe you can continue because we have exceeded the time. So here, the only thing is that if you feel that in some way the next webinars could be improved in any aspect that you have noticed. So apart from saying that if this has met your expectations, if not, or if not fully, maybe here is the space to say what more or different we need to do in such events. So yes, now there are some questions we won't see live the answers, your email, but you can put your email if you want to get notifications for the next webinars, as well if you want to get our newsletter at your email address. So whoever wants to receive information about webinar, about the newsletter, can put the email so that we can use it for these purposes. So the next question has to do with the newsletter. As Chrysula said, that we send a quarterly one, and you can be a subscriber so that you learn more about the project. And I think there is a similar one, but is related to the topic of the webinar today. Maybe Evie wants to say more about this survey, but you can again put your email if you want to participate to this survey. Thank you very much from my side as well, and I give the floor back to Petro.
Thank you, Eleni. So now I would like to ask Professor Yallouros to conclude this webinar. Yes.
Right. Thank you, Petro. I think it's been an interesting webinar, and I think very interesting information has been presented with regards to the awareness and the implication of stakeholders into 3 countries in the Eastern Mediterranean. And this is, I think, something that is done for the first time. We all agree, I think, that awareness is the precondition, the stepping stone to enter into the field of action about desert dust storms. And I think the awareness should be tailored and addressing the gaps and the worries that have been identified with the research that has been done so far. I mean, we had very nice data from Panayiotis and Evie, what people think, what they want to know, what are the things they don't know and they want to learn more about. And I think it should be more targeted to the citizen, to the stakeholder or the regulatory authority or the professional. So I think we need to be a little bit more specific about this when you were sort of making these awareness events to be addressed specifically to the audience and what we know about their sort of questions and knowledge gaps from what we have done before. Also, the early warning systems, the early warning applications is something that is really needed in order to enable to take action, because somebody has to tell you something before you do that. And I think also in this field, we need to do more. Of course, there are countries with good systems, with good sort of monitoring sort of networks. But I think across the Mediterranean, we need to do more about this, and perhaps to a higher resolution, spatial resolution. And then is the end of the action plans and the interventions. I mean, there has to be a general action plan, national action plan, and I think Cyprus has pioneered in doing that. But we need more specific sort of level interventions, recommendations. And as I said earlier, we don't really have the data at the moment of when not to go out. Should we not go out 80 days a year, 100 days a year? When, who should not go out? Stay indoors. What is the air quality indoors? Is it better? And what can you do to improve indoor air quality? Shall we use air purifiers, ventilation, other measures to reduce resuspension? All these questions on the end of the intervention and the action plans need more work, more research, but also more decision making between the stakeholders of what we should do at the end. It's a complex problem. It's there. It's going to remain there and perhaps worsen in the coming years. So we need to do more about this. And with this, I would like to conclude. Thank you all for being with us and for being so much interested in this very, triggering problem.
Okay, thank you, Professor Yalouros, for all this insightful information and because of sharing your knowledge on this topic with us and the rest of our audience. I really want to thank you for this. Also, I would like to thank all participants, and before that, of course, the presenters and the panelists of this webinar, and finally our participants for their participation in this webinar. We hope that they found the discussion informative, and we're hoping to have them with us in our next events.